Migrant farm workers work from maybe 6 o'clock in the morning to 8 o'clock at night. And so then there's no access to primary care. Only services that may be available would be emergency rooms, maybe urgent cares if they're savvy enough to know that. There's financial problems with that. There are language barriers. How do you even approach healthcare in a foreign country? Like there's no understanding of how do I find, if my ear hurts, where do I go, what do I do? Our mobile migrant program really provides this answer that is not easily available anywhere else. There are other migrant programs available within the state, but as far as I know, Great Lakes is the only one where the provider actually goes out with the unit.
My name is Tiffany Cole. I'm a nurse practitioner. I'm a family nurse practitioner and a board-certified psychiatric and mental health nurse practitioner. And I've been with Great Lakes Bay about 3 years, and I came on the mobile bus right from the beginning. We see patients who essentially have fallen out of healthcare for one reason or another. Sometimes they have lost their housing and have had to relocate. A lot of the patients that we see have chronic health problems that just have kind of fallen into a place where they can't afford their medications, they can't get their medications. We don't always know what's going to happen for them as far as the next week. They could be in a different housing scenario. So we try to just get things at least started for them.
Emmaus House is for women coming from jail, prison, or rehab. We focus mainly on substance issues, but it is behavioral modification and life skills. They're off substances when they get here, and Emmaus House teaches them how to stay off substances.
At Emmaus, I got here May 26th of 2023. I struggled with alcoholism my whole life, and I had a few seizures due to my alcoholism, and I had been hospitalized, but other than that, no follow-ups, no anything. I knew I had needed some mental illness medication, anxiety, depression, and I just didn't know where to begin. I had finally found a place I could do that on the med bus.
Oh, the med bus. It's such a blessing for us because we transport our women to all doctor's appointments, dentist appointments, all their appointments. And the med bus comes every Wednesday, and it saves us so much time and money and so much grief for the girls, because then they have to wait to see a doctor and they're not well. That could be a reason to push them back out to self-medicate, which is what we don't want.
We're an urgent care on wheels, so we really can take care of everything. And because I do psychiatry as well, a lot of the patients that I see have fallen out of their behavioral health care, which is just as important as any primary health diagnosis and needs to be addressed as equally as any primary health care diagnosis. So we do a lot of behavioral health on here as well.
I really like Tiffany. She never judged me for my addiction, and she got me back on my mental health meds. I don't know what normal is, but I feel normal, you know?
And so that really is kind of the ultimate goal, is to get folks' health back on track, because when you don't know where you're going to sleep tonight and when you don't know what you're going to eat tonight, making sure that you have your blood pressure medication or that you've had a mammogram this year really is kind of low on your priority list, but it's high on our priority list. And so it's our job to kind of fill in those gaps for the folks and make sure that what they need is being taken care of.
I've been with Great Lakes Bay Health Centers for about 6 years now. I've been Director of Vision Services for 2. I have so many stories about students coming in, and sometimes they don't even realize they have poor vision because they've gone their whole life without seeing clearly. One particular story got me as a student came in and picked up her glasses, and she put them on and looked in the mirror and started crying and looked at her mom. She didn't even realize she had freckles before, so she was seeing her face clearly for the first time and realized that she actually has freckles. I only wonder how well she could have done at school if she was seeing clearly the whole time.
It's funny because when you first think about going to see a dentist or bringing your child to see a dentist, your initial thought is going to be your child being nervous or fearful, maybe crying or putting up resistance. It's not like that at all. The kids love the dental bus. Very rarely do we have tears or fear on the bus. They come on happy and they leave even happier.
So currently our mobile dental department goes to 126 different schools in the Great Lakes Bay region. A lot of the dental staff has noticed when students come in, they're struggling with their paperwork and they're just having a difficult time getting the parents to bring that student into an eye care provider. And so taking the mobile vision on the road, we would go in there with all the equipment we have in our current offices. We'd be able to diagnose and treat ocular disease. We'd be able to prescribe glasses. Students don't even realize they have blurry vision because they've had this blurry vision their whole life. And by providing a comprehensive eye exam, we'd be able to detect any blurry vision or any binocular vision disorders that are slipping through the cracks and get those things corrected.
It's reading books, everything, everyday life, there's no impact, so how do I know? Only when I got the letter from the dental bus and others, then I got, yes, you need to go to the doctor first, because we don't know what's happening, because we don't visit the classes, because I was nervous when I got the report from the doctor, they say, hey, what happened? Then someone said, you better go to Great Lakes, they're really good. Finally, I am relaxed that I got the glasses. I'm thankful to the Great Lakes Bay.
It's no fault to the parents, to the student. It's just difficult to fit an eye exam in sometimes with work schedules, school schedules. So.
A lot of the patients at Emmaus and really any of the sites may already have a healthcare provider, but just may be in a situation where today I'm feeling acutely ill. And so coming to these sites really provides people sort of an urgent care type situation.
It makes it really easy because I have a good relationship with Tiffany and the girls feel comfortable with her. She's not judgmental. A lot of girls have had bad experiences with doctors and hospitals. So it's a relief to them and it gets them able to take care of their physical and mental health because they're not afraid.
And I've had a lot of doctors treat me different because of my addiction and think I was, drug seeking, and they wouldn't take me seriously. And with Tiffany and on the med bus, I've never felt that judgment. I felt so much so that I made her my primary care doctor, because she never made me feel like when I came in with a pain or whatever that I was coming in seeking. She listened to me and trusts me, and I trust her.
I put her right up there with my sponsor, the med bus. Huge part of my recovery. Very big part of my recovery. I think it's really important that they do go to the rehabilitation centers. People are afraid, and seeing other people going on it and dealing with their problems is very encouraging to others.
I feel like, we're really making a difference in people's lives. That's when you really see the effects, and the patients really make it worthwhile. It's really rewarding as a provider to see somebody that says, I'm so glad you were here today, because if you weren't, I don't know how I would have gotten this taken care of.